The purpose of the study was to look at the integration of gerontology nurse specialists into the care of older people living in residential aged care by partnering with nurses and healthcare assistants to bring that specialist gerontology knowledge in secondary care to the people that need it most in residential aged care. We started the program in 2007. We did the evaluation in 2008 and 2009. And it was published in the Journal of the American Geriatric Society last year. And what we found was that there was a significant difference in hospitalizations from the control group compared to the intervention group. We then, in 2010, did a follow-up study using, kind of tweaking the model, where we included multidisciplinary team meetings with geriatrician, pharmacists, nurses, and the GP. And we found overall there wasn't, with the randomized control trial, there wasn't a difference in hospitalizations. But when we did a secondary analysis, what we found is that we did impact significantly hospitalizations for the top chronic diseases, such as respiratory and cardiac diseases, that we know from the literature is impacted by a care coordination approach. And then we did a follow-up study, an implementation study, where we tweaked the model just a little bit more so that the gerontology nurse specialists did more clinical coaching, hands-on, one-on-one with the nurses. And what we found, we're just preliminarily doing the analysis of that study, and we're finding that there is overall a significant difference in hospitalizations. And so for us, what we've learned out of this is that we've learned that the model itself, it needs to be tweaked in that there needs to be a really close collaborative relationship with the nurses and the gerontology nurse specialists, a one-on-one clinical coaching relationship. It needs to be proactive so that there's not a referral, so that the gerontology nurses go in on a regular basis and establish a relationship. And also that the geriatrician and the GP collaboration improved the model as well.